Hi everybody, happy Friday. It's weigh-in day and it's a beautiful day. As you can see, the sun is shining through and I was gonna shut the curtains so there wasn't quite as much of a glare, but I just can't bear to shut the sun out when it's actually coming through my window. So I'm gonna leave it there. Anyway, I have once again some slightly disappointing news for the weigh-in. I got on the Wii Fit this morning. The glare is a bit much, isn't it? Maybe I'll get closer. Anyway, I got on the Wii Fit this morning, and I had only lost 1.3 pounds last week. So while it's not a gain, I'm very happy about that. I still would be expecting to lose more weight, being that I'm still doing Couch to 5K. I am on week 2 of Couch to 5K now, which doesn't mean that I've only been running for 2 weeks. Really, it means that I graduated to the next um, step, I guess, or whatever. There, it's broken down into I think 8 or 9 weeks, but I don't know how many people actually go by those weeks because seriously, I wasn't ready to go to week 2 after just 1 week of week 1. So anyway, I'm on week 2 now. It's going to be like my third or fourth day, I think, doing week 2 of Couch to 5K today. I run on Fridays, Sundays, Tuesdays, and then I've usually been squeezing in an extra day somewhere in there. Partially because it's been freaking me out that I've been gaining weight, and so I've like added an extra day, which I think I'm gonna have to take back out because my knees can't really take the running that much, unfortunately. I don't have severe knee pain, but they do kind of ache, and they feel it after I run. So I understand why you need a day in between to recover after doing that kind of workout. So anyway, 1.3 pounds lost this last week. Not what I was hoping for. Better than gaining. But seriously, I'm just hoping that my work is going to pay off one of these days. I think that's just the hardest part is that, logic tells me that I'm doing all this working out, like my body's freaking out, it's holding on to weight, whatever. My muscles, muscle weighs more than fat, they're retaining water because I'm building muscle, the muscles are healing, whatever. All that stuff, is very logical, and I want to thank you guys for pointing that out and supporting me. Um, but it's just that I want to be rewarded for all this hard work I've been doing. And I'm very much an instant gratification person, and I have not got that instant gratification from running yet. And running is still hard for me. I'm not quite enjoying it as much as I hope to. It's getting better, but it's still hard. And so it would be nice to be rewarded with a nice big number on the scale every week, but it's not happening yet. So I guess I just have to be patient. Anyway, there's not a whole lot else to talk about today. I'm going to be going to the doctor this afternoon, not for me, but for my son. We're going to try him out on a different medication. My son has ADHD. I don't know if I've mentioned that to any of you guys, but, um, and he's been on a certain type of medication that requires you to give him a small dose, like several times a day. And so we're going to switch him to something that's a little bit more um, modern, I guess, or something newer that is more like a time release medication that hopefully will help. Yeah, so it was time to rework his dosage anyway. He's been going through a lot of growth spurts and he's gained quite a bit of weight, and so his old prescription just wasn't quite working. We need to up it. So anyway, I'm going to go, and my doctor is actually, sees my son as well, and it's been funny because I haven't been able to get in with her, and I really need to because it's really overdue my blood work. I need to have blood work done to check on my vitamin levels, and I haven't for quite some time. And the only reason is that it's really hard to get in with my doctor, and I really don't trust anyone else to do these things for me. I mean, she's just awesome. Um, and she always, I don't know, she's just really supportive. She knows what she's doing. She's had other patients that have had gastric bypass and that have gone and done it outside of the country. She was one of the most supportive people for me as far as, me having my surgery in Mexico. She told me when I was considering it that, Mexico is the place to go for weight loss surgery. They do a lot of them there. Their doctors are highly skilled at it. She said that patients will go to like India for knee replacements and hip replacements, and they'll go to Mexico for gastric bypass, and they'll go to, whatever. She listed all these different countries and why people are going there. This whole industry, medical tourism type stuff. I mean, it's just booming right now. It's crazy. But anyway, so I just love my doctor because she's so supportive of me, and she's always really encouraging and really helpful and has a lot of good information for me when I go in. So I don't really want to switch doctors to try and get in and get my blood work. So anyway, long story short, I just haven't been able to get in with her, and so I probably haven't seen her since, gosh, like the beginning of the summer. So it'll be interesting. She is probably going to be shocked at what I look like now because it's quite different than from when she saw me last time. So, um, anyway, what else was I going to talk about? Why can't I remember? Yeah, my last video, the pregnancy video, I know a lot of you guys kind of chimed in on that topic, and it was interesting. I think what prompted me to make the video, I was telling Sarah Will Be Skinny this morning. We were chatting online, and I watched this special. It was on TLC, the Learning Channel, about a woman who was pregnant and she had an eating disorder. And it was very enlightening because she was talking about her feelings about food and exercise and how just because she's pregnant, it doesn't really change that for her, and she still has this compulsion to want to exercise more to compensate for the calories that she's taking in. Even though she knows that she's feeding her baby, she needs extra calories and she needs to gain the weight, it's still just very emotional for her to be able to put in the extra calories and then to try and fight the urge to exercise to get the calories burned off. And I think that's what sort of sent me into a little bit of a panic, because then I started thinking about in my own brain, well, if I were to ever be in that position, if I were to ever be pregnant again, I think I would have thoughts that are really similar to this woman who had an eating disorder. It was very, very scary and very, very enlightening. And so that's kind of what prompted that video, in case you guys were wondering. Yeah, so enough about that. The other thing I've noticed lately is that for me, I'm over 9 months out from surgery, and losing weight, exercise, diet, counting calories, um, gadgets to help me lose weight, like workout clothes, shoes, like all that stuff, I'm totally obsessed with. Totally obsessed with it still, 9 months out of surgery. And even though my weight loss has slowed down, I think like my obsession with it has even gotten more than what it used to be. Sorry, my screen just went to screensaver here. Um, so I've noticed that like everybody else involved, like in my life, like my boyfriend, my family, some of my friends, like they're over it. They're so over it. They're like, whatever, you've lost most of your weight now, so let's move on. And in my head, I'm still like, wait a minute, I'm not done yet. I have a lot to go. I'm still like, I still have to worry about these things, and um, I still talk about it all the time, and people aren't wanting to hear about it anymore, which is really hard. I'm having to really tone it down and try to concentrate on talking about other things, like with my boyfriend and with my family. And I've noticed that people that I used to talk about weight loss with, who were smaller than me, are now bigger than me, and so they don't want to hear about it. I don't know if any of you guys have experienced that, but it's a very, very strange situation. Like, I have to hold myself back, like when I get really excited because I dropped down another size or something. Really, of course my phone's gonna ring. Okay, well, I'll maybe make another video about this later, but I gotta go for now. So, get the phone, but I will talk to you guys later. Bye.